Hi, I'm Claire Reid from HSJ. Today I'm chairing a roundtable debate looking at how the NHS can drive the prevention agenda. And we're specifically looking at the role that charities might play in that shift. We've put together a really great panel with representatives drawn from the NHS, from the third sector, and indeed from local government. I think it's going to be a really interesting debate.
It feels as though there's still some more progress to be made, and particularly I think that interface between a large commissioning system and the prevention needs of an individual, pretty large gap there, and they don't always work well together, so some progress there, I think.
We see fantastic practice in locations, but what happens is that the good practice does not get replicated. So where you have something that you can really prove evidentially is saving money, saving the NHS and doing all those things, is actually just isn't translated in another part of the NHS. So how do we get this good practice moving around?
The first thing to say is I think it's really important that we frame the question in terms of what can the NHS do to support charities, to support people to live happy and independent, healthy lives, rather than what can charities do to help the NHS. And I think, that's a fairly fundamental shortcoming, I think, often in the NHS historically, certainly in our approach to charities, is how can we find a charity that will solve an NHS problem for us?
The real value, I think, for the third sector is it's a different model. It's not a clinician treating a clinical problem. It's a different approach under a clinical governance framework. We've seen that with our cystic fibrosis programme. Actually, you get a fitness professional talking to a physiotherapist, talking to an NHS trust. Actually, you'll see with a weekly supported programme, a £7,000 per child in-year saving for that trust. All of a sudden, I've got 12 trusts that actually want to do the programme because I've proven the business case, but the business case around that individual patient, it all goes back to that clinical outcome for that family and that individual.
Actually, I think what's needed is a lot more data such that we can get from that the insight of why things work and why they work for people, as well as some of the qual stuff, which actually is needed a lot of time in the NHS. People will ask about sustainability, and it's still one of the challenges around the perception of the voluntary sector that things aren't sustainable. You need to go and get another grant. You need to go and find a donor. Whereas actually, what I've seen from the smallest to the largest charity sector organisations that are working in healthcare, they are clearly delivering value.
I think the good news there for people in the systems or struggling to think about how do we engage with the voluntary sector is there's actually a core question about leadership and culture that if we can get the necessary change in place, it won't just make it easier for people in health to work effectively in partnership with the voluntary sector. It will also mean that they can draw in thinking and expertise and capacity from a whole range of other sectors.
Let's say you do apply the principles of community engagement and you, as a result of that, derive a picture of what's needed. This whole point that a number of people said, so what is the problem first, right? And then you work with the people in that community and design services that actually they can respond to and work. They are bespoke and it's co-produced, and you do all the stuff that you should do. And then you take that to the commissioners, the CCGs and the local government. You say this service is better than what you've got now, probably cheaper, better outcomes. There is a risk, and I've experienced this, there's a risk that the responses are. But we have the power to deliver this service and smart people are very good. They'll welcome it with open arms, but they'll also see it as a fundamental threat to the power that they have to deliver these services.
It's not about saying, I'm going to take what Stephen's doing here and I'm going to just take it and drop it over here. Completely. And the trouble is, when we are fixated on fixing a problem with a ready-made solution, the danger is we do that if we're not prepared to engage in the hard work of understanding the principles, the practices that are underneath it.
If you help communities create the right conditions for people to live in, whether that be the obvious stuff of housing and a good job and a roof over your head, but also social connection and properly resourced community groups and organisations that are embedded in that community, guess what? They'll find their own way to an improved health and improved life.